Bore da pawb, croeso i'r cyfarfod heddiw. Welcome everyone to today's meeting, the last meeting in 2020 of Powys Teaching Health Board, and this of course will be a year which will go down in history. So I hope we'll enjoy this last meeting and hear some very positive reports. The meeting is being held virtually and is being live streamed via the Health Board's website. It will be available to view after the event. Welcome to board members, representatives from the Community Health Council. We have Katie Blackburn here. Unfortunately, Frances Hunt is unable to attend. So she has sent her apologies, and we hope to sort out some means by which she will be able to attend our next meeting, Katie. Welcome to any observers present, including Rebecca Collins from HIW, Elaine Matthews from External Audit, and Helen Higgs from Internal Audit. So I'm Vivian Harpwood, Chair of Powys Teaching Health Board, and also present today are Mel Davis, Vice Chair of the Board, Francis Gerard, Ian Phillips, Mark Taylor, Susan Newport, Trish Buchan, Tony Thomas, Matthew Dorrance, our independent members, and then from our executive team we have Chief Executive Carol Schillebeer and the following executive directors: Jamie Marchant, who is Deputy Chief Executive and Director of Primary Community Care and Mental Health, Julie Rolls, Director of Workforce and Organisational Development, Hayley Thomas, Director of Planning and Performance, Alison Davis, Director of Nursing, Claire Madsden, Director of Therapies and Health Services, Pete Hopgood, Director of Finance, Paul Buss, Medical Director, and Stuart Bourne, Director of Public Health, sent his apologies. He's on annual leave, so Carol Schillebeer, our Chief Executive, will cover the item that he was going to present dealing with the EU. Also present is Rani Mallison, Board Secretary, and Katie Blackburn, Chief Officer of the Community Health Council. Well, apart from the apologies I've already mentioned, no other apologies have been received today. Please note that participants may look away from time to time to access documents. Although this is a standard routine meeting, we have tried to keep to essential items only because it's a very busy time for our exec team, as I'm sure everyone will appreciate. So moving to the agenda now, which is published on our website along with the papers. Could I please turn to declarations of interest? We have had a declaration of interest from Trish Buchan in respect of item 2.4, winter pressures. Trish is a trustee of PAVO, which receives ICF funding under the ICF stream. I don't think there are any other declarations of interest today. Have you received any, Rani? Probably not, or you would have told me, I think. Thank you.
Yeah, no.
All right, thank you. So could we turn to the minutes of the previous board meeting held on the 22nd of October, first of all, for matters of accuracy. Are there any matters of accuracy that anyone would like to draw to our attention, please? On page 1, 2, 3, 4, 5.
Chair,
6,
page 5.
Yes.
Sorry,
Yes.
it's Hayley Tom speaking. Page 5, just under bulk oxygen storage, it was referencing, we had 3 sites. It references Newtown was nearing completion, but it was Welshpool, Chair.
Oh, yes, thank you.
Thank you.
Thank you, Hayley. Page 6, 7, 8, 9, and 10. Thank you. in terms of matters arising, which are not on this agenda, perhaps it'd be better to turn to the action log first.
Thanks, Chair. Did you want me to take the
Yes,
action
please.
log?
Yes, please, Ronnie.
So there's 2 actions included to date. Both include an update in the progress column of the paper. The first is in relation to risk management, with a specific focus on assessing the risk, the workforce risk included on the corporate risk register and the COVID-19 risk register. An update of which is scheduled to the Performance and Resource Committee in December. And then the second action is in relation to the an update on the Grange University Hospital. That update was provided to the Experience, Quality and Safety Committee on the 6th of November, and a further update is included in today's papers.
Thank you. Could we then turn to the record of the annual general meeting held on October the 22nd? Are there any comments on that, please? I think you should all have had time to study those minutes. Much shorter document. Any corrections? No, thank you very much. Yes.
Chair, I think Ian Phillips would like to ask a question, please.
Oh, I'm sorry, Ian. I'm sorry. Yes, thank you.
No problem. Just going back to the first set of minutes on yes. Page 5 and the North Powys Wellbeing Programme business case. I just wondered, for the convenience of the general public, whether the report could be just accessed. Or you've said it, sorry, I haven't read the minutes properly. That's my apology. It is accessed via the website on the presentation, yeah? I just wonder whether it would be helpful to actually just, for folk have to go through the whole thing, to make that available as well via a link or something.
I'm sure that would be possible. I'm not being the technical wizard I need to be, Ronnie.
Yeah, we'll pick that up.
Okay, thank you very much. So if there are no other matters arising from the minutes of those 2 meetings, could we then turn to agenda item 1.6? And the first update is my own, which you have in front of you. Very brief. I don't propose to dwell on that. The meeting that I chaired, actually I chaired jointly, of the Rural Health and Care Conference for Mid Wales on the 11th of November, which was Armistice Day. I would like to highlight that because I think it's very important for rural healthcare to have these research conferences and meetings to report what we've all been doing. But also to highlight the fact that it's a very good example of collaborative working across Mid Wales, including the other health boards. And we did have participants from as far apart as Brazil, where we had a presentation, a very good presentation about how they're dealing with issues in rural healthcare. So a large number of participants, some eminent speakers, and we were very pleased to welcome Ellen Jones, who read a poem by Heath Wynne, because it was November the 11th and Armistice Day. So actually a lovely meeting, despite some technical problems. But that was all I wanted to report. So if there are no questions to me, can I ask the Vice Chair? She has already told me that there was nothing specific to report, and I'd just like to confirm that, Mel.
No, Viv, I've just been going to meetings as usual, safeguarding, corporate parenting, and there isn't anything in particular except to say that those meetings have been conducted and they are proceeding.
Thank you. So that means we can turn to Carol Shillerbeer, Chief Executive. and her report is attached. Carol, over to you.
Thanks very much, Chair. Thank you, colleagues. There is a pre-circulated report that's been made available. I'll just take the opportunity to draw out a couple of key elements of the report. In particular, I've been starting all of my board reports during this year with an update on the pandemic and both its direct and indirect impacts. So I continue to do that. Clearly, we have just over the last week or two come out of national restrictions and firebreak, and we are tracking through the impact that that has had. It has had a positive impact on numbers of cases, and currently as we speak we're at approximately 83 per 100,000, which is a significant reduction on a couple of weeks ago. There is a strong note of caution, however, in that we are starting to see those numbers creep up, and we are expecting them to continue to increase. And clearly there's a lot of discussion now about measures that will need to be taken potentially either before Christmas or after Christmas, and of course quite a lot of topical discussion about Christmas seasonal festivities. So we would, of course, as a health organisation, encourage people to continue to take all of the sensible precautions that they can, particularly in terms of social distancing, not mixing too much in social settings, hand hygiene and the use of face coverings. So just use this opportunity to reinforce that. We have unfortunately had COVID transmission within some of our higher risk settings, both in terms of care homes, but also in terms of community hospitals, and we are managing that very tightly. This is a feature, unfortunately, of the higher transmission rates that have been seen throughout our communities, and in particular the risk of asymptomatic transmission. And then I just wanted to finish this on a slightly brighter note. And Chair, you mentioned that there was some good news in some of these papers today, and just to end my that bit of my report to say that we're working extremely hard to ensure that we're able to get the COVID vaccination programme underway. There are some complexities and challenges with the different types of vaccines that are coming through currently, so we need quite a flexible and agile approach. But we do intend, with all the best intelligence that's coming through government routes at this stage, to start some form of vaccination prior to Christmas. Our main mass vaccination programme with the public is likely to start in the early part of 2021. Now, there's still a couple of hurdles to navigate in order for that to happen, not least getting final confirmation of the vaccines that are coming through to us. So it's still very much work in progress, but you know, we've been talking about light at the end of the tunnel, and this does provide a real opportunity of optimism, although of course it isn't the panacea. We will still be continuing to work in a COVID environment over the next 6 to 12 months, and we'll be focusing on the recovery from that. So that's on the COVID update. In relation to then the Grange, it was picked up in the action log. I am pleased to say that the Grange has opened on the 17th of November as planned. Our work under the South Powys Pathways Programme Board has enabled us to take confidence in the arrangements that have been put in place. And at yesterday's programme board, I can update members that we reviewed the one outstanding risk that we were reducing but not hadn't fully managed, and we have reduced that risk following some further work. So we're in a good position in relation to that. huge amount of effort gone into communication and engagement, and that will continue, and we're closely monitoring the situation as we move forward. And then I just wanted to pull out on staffing matters a couple of key areas, and that we have appointed a medical director to join us, and thanks go to Dr. Paul Buss, who's part of the meeting today, and to Dr. Catherine Woodward for supporting during the intervening period. So that is excellent news. And then just to say that the staff survey has, I believe, closed. It was due to close last night, and we'll look forward to hearing the reflections of staff throughout the Health Board in helping us to move forward. So I'd like to say thank you to everyone who took the opportunity to participate in that. So that's my report, Chair. Happy to take any questions.
Thank you, Carol. Are there any questions, please, for Carol? I'd like to echo my thanks as well, Carol, to everyone who's contributed to the work of the Health Board over these really difficult months. Any questions? Okay, can we move on then, please? To the second section of the agenda, items for approval, ratification or decision. And we'll start with agenda item 2.1, which Carol, you will present the Strategic Objectives 2021 60-day review.
Thank you very much, Chair. So, board members, you'll recall that we, at the very beginning of the year in January, signed off our integrated medium-term plan and our annual plan, not fully appreciating what we had ahead of us. And then during the summer months, during May, we revised that a little, and then in July took a major step to ensure that we were really focusing on the critical strategic priorities, of which we had 12. We committed to reviewing the strategic objectives at least every 90 days or sooner, depending on the circumstances. And so this report brings forward an update in relation to those strategic objectives. But it also proposes adding in a 13th strategic objective, which is around planning ahead. So just before we go through that, I hope that this is a helpful report that just tries to pull out at the headline level the work that is going on across all of the 12 priorities. Clearly, there are a number of areas where either committees themselves or the board has taken more detailed papers, and there's a couple of papers on the agenda today that go into much more detail. I don't plan to talk to the paper specifically, apart from just highlighting the proposal around the 13th objective. So this is a baker's dozen of objectives, and it's about planning ahead and preparing for 2021-22. So the strategic objective in relation to that is really to have a structured approach to planning for next year, which we hope will be very much a transition year from the pandemic into a post-pandemic era. There's still quite a bit of uncertainty around that, of course, but the sense of trying to be on the front foot rather than the back foot is key. A couple of areas to draw out. We want to be clear about our assessment of learning and our reflections, and I've just mentioned the staff survey as being one of the ways of reflecting on what we've learned, but also our new ways of working, a commission from the executive committee to understand how we have changed and adapted during the pandemic, understanding the latest evidence, particularly around the impact on the population of the pandemic, so economic factors, social factors, and others. The issue of access to health services, how we've adapted, but also the really concerning challenge of significantly extended waiting times. We'll come on to the performance report later, and I will be drawing attention to the significant numbers of people who are waiting to access care and treatment. For us to identify our critical priorities, the proposals that will help to deliver that, and then that would form a formulated annual plan for next year. So I've just spent a little bit longer on that priority because that's the one that is new and being proposed. So the paper really updates on the others and asks for approval of that 13th strategic priority. Thank you, Chair.
Thank you. Are there any questions for Carol before we consider approving this document? No, thank you. I always worry slightly because in the law of contract, there's a very clear rule that silence can never mean you agree or assent. And it appears that by custom and practice throughout all virtual meetings during the pandemic, the reverse is true. Please do speak up if you do not wish to approve. Otherwise, can I take it, please, that we all approve these revised strategic priorities and that we recognise the need for flexibility and regular reviews. Thank you. I can see a couple of approvals there, so we'll take it that we do approve. Thank you very much, Carol. And now I'd like to ask Ronnie Mallison, Board Secretary, to speak about our our ability and indeed achievements in maintaining good governance arrangements during the COVID-19 pandemic, Q3 to 4 governance arrangements in particular. Ronnie, over to you.
Thanks, Chair. This paper presents to the board a further update to the item presented in May earlier in the year. The paper sets out arrangements for ensuring we can maintain an appropriate level of oversight and scrutiny at a board level as we discharge responsibilities during Q3 and 4. The paper also provides for the board's information the revised governance framework for the strategic goal command and control structure that's attached for information at this stage. The paper sets out a proposal for the board to continue to run its meetings and its committees as set out in the agreed terms of reference, with regular frequency of meetings continuing. There is a proposal that the committee frequencies will be amended for remuneration in terms of service committee and the executive committee, which will meet as deemed necessary with the chair and chief executive for those. In addition, we are proposing, it's not included in this paper, so apologies, but I'd like to propose today that we re-establish the regular informal briefings for board members as we move through the winter period to ensure board members are cited on progress. And the paper asks for the board's support on the direction of travel set out. Thanks.
Thank you, Ronnie. I can see that Ian Phillips would like to comment on governance, please. So, Ian?
Thanks, Viv. A really good and clear paper, Ronnie. Thank you for this. I was just wondering whether it would be helpful for us to say something about the channels of communication that remain in place for things like raising concerns, and that we continue to keep a close eye on risks and incidents. For any sort of developing trends, things that perhaps we take for granted, but it shows that we are not taking our eyes off these things during these difficult times. So just a reflection on reading the paper.
Yes, of course. And the paper does refer to the internal audit review of our governance arrangements during phase 1 of the pandemic, and also structured assessment undertaken by Audit Wales, are both positive reports on the whole. So we can bring all of that together as we move forward into the next phase of reporting. Absolutely.
Thank you.
Thank you for raising that, Ian. Trish, you would like to comment too, I think.
Yes, thank you. I did find it a very clear paper. Thank you, Johnny. I do understand why we are not working. Our advisory groups are still not established, and therefore that we're not using them. but I think it is important to evidence the engagement we have with clinicians and stakeholders as we go forward. I know that we do a lot of it, but I'm just wondering, have we got, are we evidencing that?
Thanks, Trish. I know that you don't sit on the Audit Risk and Assurance Committee, so if I could just update you on a discussion we held around the findings of the structured assessment by Audit Wales. We have committed to bring forward a paper to the board that sets out clearly the existing mechanisms that we have for engaging with our stakeholders and our clinical colleagues, so that we can take a risk-based approach on the establishment of that full advisory group structure and be clear about the mechanisms that we maintain during this period. So we will bring that forward to a future meeting.
Thank you.
Thank you. Carol, would you like to come in on that as well?
Yes, thanks very much, Trish, for that question. I think I can probably just give a couple of examples of where both at wider stakeholder and partner level, but also at clinical level, engagement has been really strong through the pandemic process. So just on a health professionals level, clearly our clinical executives on the board have their own professional infrastructure and advisory infrastructure, and I know that that is continued and actually enhanced during the pandemic, given the challenges that we have been facing. We have a GP and exec joint forum every other week. We link with a small group of GP leaders. That helps us to get feedback from the front line in terms of that part of primary care, and with our cluster leads as well. We have, through the South Powys work, for example, had a number of clinical summits and continue to have clinicians as part of our South Powys programme. And on the wider stakeholders, I think we have worked really well with Powys County Council in terms of being able to update county councillors, for example, the cabinet and elected members. And we've run sessions jointly. And then finally, with the Community Health Council, a lot of work, briefing sessions, discussion workshops as well. So this is just a flavour of the engagement work that we continue to have. So whilst we fully recognise that the fora that have been described are not fully established in the way in which the standing orders might require them, the full outcomes of and the spirit of the standing orders are indeed being implemented in practice. So hopefully that helps, Trish, as well, with assurance.
Thank you, Carol. Now we are asked to ratify the approach outlined in this report to ensuring an appropriate level of board oversight and scrutiny to discharge our responsibilities effectively during the COVID-19 and control structure for quarters 3 and 4. So again, can I ask you to approve, please? And if you do not want to approve, would you please speak now, or at least indicate now? No? Thank you. So can we take it that that is approved? Good.
Thanks.
Thank you very much. Thank you, Ronnie. Thank you. So now a really exciting item. I've been looking forward to this. The proposal for a Powys Health and Care Academy, which Carol will introduce and then hand over to Julie Rose.
Thank you very much, Chair. I agree, a really exciting item, one of our 12 strategic priorities, which I know that there perhaps was a question about whether this indeed should be one of the 12 strategic priorities. But as we have been particularly working through this pandemic and with a thought to now planning in earnest for the recovery through next year and beyond, it's really clear that the focus on workforce and the talents that we have within Powys are critical to the success of health and care services. I know that Julie will come in and comment a little bit more on the Workforce Futures framework, which of course the board approved earlier in the year, and this is the first sort of a major flagship development from that Workforce Futures strategic framework. Partly the reason I'm presenting it is that I'm also currently the chair of the Regional Partnership Board, and I'm really delighted that the RPB has really embraced this as a core priority, and there's been a really strong engagement across the health service, local government, and in particular social care, but also the third sector and others in helping to develop this. And we've developed it very quickly, and the paper in front of you is really a proposal as a blueprint, a starting point really for our Health and Care Academy. You'll see that the paper itself outlines some of the real both challenges that we've got in Powys around workforce, and in particular the availability and access of education, training and development, but also the strengths that we have as well as a county, and it is these strengths that we're looking to build on. There are two elements really to the paper. One relates to the blueprint of the academy, and we're looking to structure it around 4 schools: School of Professional and Clinical Education and Training, School of Research, Development and Innovation, School of Volunteers and Carers, and School of Leadership. And again, multi-agency, cross-sector schools. We have been working with Health, Education and Improvement Wales and Social Care Wales on some of this as well, which is proving to be extremely valuable, particularly as new commissions for undergraduate education and non-medical are stressing a more outreach model into all parts of Wales, and I think we'll benefit significantly from that. The other part of the paper is the development of one of our buildings to be a physical environment, to supplement a digital environment for learning as well. And I'm delighted to say that integrated care funding has been awarded to this multi-agency project, so we do have funding behind it. So I'm not going to go through the huge detail. I'm very happy to come back in as necessary on this, but I'm going to just hand over to Julie as the chair of the Workforce Futures strategic programme. Thank you, Chair.
Thank you, Carol. I think you've probably said as much as I would want to say. We are incredibly excited about this opportunity. And when I say we, I'm picking up your point, Carol, it is across the sector. I think it is vital. We know we're in the midst of our current situation, but focusing on the future is absolutely vital to achieve all those aspirations we've articulated through the Workforce Futures document that we've signed up to. And for me, the Academy is more than a physical space, but having that physical space of granularity so people can come and see in action as well as feel it is absolutely vital. And I've been overwhelmed by the support that we've got from our partners in terms of voluntary sector and local authority, and the chance to have universities in reach in our footprint, but for the population of Powys to start their professional career in health and care at whatever level that will be, and to then move through to any profession they want within the health and care sector is absolutely really at the cutting edge for us. I don't think anyone else is doing anything like this. We know that we don't have the university on our footprint. This really gives us a chance to have that virtual university within our footprint. And so it really does feel that today and this facility will be the future workforce for us that we've already articulated we want.
Thank you, Julie. We do have an opportunity to discuss. If anybody would like to ask any questions or make any comments about this, It's not the last we will hear of it. I'm absolutely certain about that. Does anyone have a question or a comment?
Chair, I think Mark Taylor would like to come in.
Oh, right. Thank you. Mark?
Thank you, Chair. Yeah, it was just 2 points. The first was in the blueprint, which looks at the second bullet point, and wondering whether part of that needs to be uncoupled, which was around being the sector of choice. Entirely agree with growing the health and care workforce, but if you're going to be judged against those, actually creating the sector of choice may perhaps go outside the scope and deliverability of this scheme. So that's just an observation. The other point relates to what needs to be in place to support this scheme. And one of the things that I couldn't see within this structure was the business case stroke financial plan in terms of how this is going to be funded and sustainable in the future. So I think in terms of that work and preparation that needs to be done at pace, that may well be done, but it certainly wasn't included in this paper. And I think it's a sort of integral or important part of the project that needs to be brought forward.
Yeah, oh, sorry.
No, sorry, Carol. I was going to pick up the first point. I think in terms of it's about being the sector of choice when people are looking for their careers, and Mark, and actually it isn't all about this building. It is about the Workforce Futures strategic framework and then the academy that can support people's career choice. So perhaps we need to make that a little bit clearer.
Yeah, it's just in terms of, if you look back in terms of what you can achieve for this, growing the health and care workforce is entirely within the gift of this project, but to actually make it a wider sector of choice is very challenging, and I'm not sure it would be a fair reflection on this particular project, but that's just a comment. I'm happy for you to keep it in, but it's very challenging.
I think it's for the overall Workforce Future strategic framework. We want to be the sector when people thinking about choosing their careers. So we're thinking about people coming back into work, or those people that are choosing careers within schools are thinking that this is the sector that they want to get into. So I know it's ambitious, Mark, but that is truly our ambition. And actually, in terms of sustaining the services we want at all levels, and it isn't just about paid workforce, it is about volunteers, etc. That is our ambition, as we've stated it within the Workforce Futures document. So no, it's challenging, but I think that, you know, we have identified we're up for that challenge.
Perhaps I could just add a couple of things. Thanks, Mark. And you know, it's a really great challenge to us, really, about measurable outcomes and what we really feel we can achieve. Certainly in relation to that, you know, I looked at that a couple of times because, you know, I think we've got to be both realistic as well as ambitious. But what we're hearing is that because undergraduate education is often outside of the county, people will perhaps make other choices rather than come into health and social care. So if we can bring more education closer to people, hopefully that will mean they will choose this sector to pursue. So we'll have to be tested on those outcomes, I think. The sense of the underpinning infrastructure and the development, you know, you're absolutely right, and there has been some work done on this already. I think that there has been a sense of, we do invest currently in education, training and development. We invest in it in our own little silos, if you like, sort of health, and even within health, we've got different sector, different parts, you know, medical education, non-medical education, both in social care, but also in the third sector. So the first step and the piece of detailed work that has been mapped out is, what are the current resources that we've got, and is there a potential to pool that resource? So as a stage one. what I'm really keen to see, if there is support for proceeding in this way, is that we then plan that investment over the coming years, and now is the ideal time as we are planning ahead to be really setting out the level of ambition and what it will take. There is a draft implementation plan which we didn't include in the papers because it does need a little bit more challenge and discussion about pace and timing in there. So I think that that can come forward as well, Mark, as well, in terms of the detail of how to achieve the ambition, not just what is the ambition. So thanks for those comments.
Thank you. Actually, I can see now. I was unable to see, Mark, that you wanted to ask a question. Sorry, but I can see that Dr. Paul Buss might want to come in too.
Yes, thank you, Chair. I just wanted to say that I honestly think this is an extraordinarily important thing for Powys. When I've made contacts with clinicians around Powys and outside of Powys, they're all looking forward to this development. And from my view, I think if we're going to develop innovative approaches to clinical outcomes, as Carol was saying, measuring clinical outcomes, using that to support improvements in areas like value-based healthcare, but also to seriously look at how education itself impacts on performance. We've got a great potential with the Healthcare Academy. The interesting thing is, for 20 years, we've known that educating workforce not only attracts the workforce, but improves outcomes. And I think that gives Powys a real edge. Our USP is community, primary care, social care and partnership. And I think it's a fantastic development. So I know the clinical community, both medical, nursing, therapists, would really welcome this going forward.
Thank you, Paul.
Thank you, Paul. May I add just one more comment, Chair? And that's that you know, we recognise we're at the starting point, and you know, we want to gain confidence in our ability to improve the education, training and development offer, and in particular then sort of build on our learning, particularly around how we might develop future hubs. That would be the intention, and in particular, obviously at the last meeting we approved the North Powys Wellbeing Programme business case, and there's a strong connection of a further educational development aspect of that programme as well. So geographically, whilst we're talking about making a start in South Powys, the real potential of having a North Powys hub feels very exciting as well. And by the time that building comes to fruition, we will have learnt an awful lot. But I would just stress this is also underpinned by digital access. So again, getting confidence from our recent developments and stretching our ambition. So thanks, Chair.
Thank you. Katie, I think you wanted to make an observation as well.
Thank you, Viv. Yes, no, this project wouldn't really come across the door of the CHC, but I just wanted to comment and just say how exciting this is. We all know the impact of the challenges of recruitment and workforce futures, and that does fit within the CHC's remit, and you know, it's something that we work with the Health Board on a daily basis. So just to reiterate that I'm so glad it's ambitious, I'm so glad it's so exciting, and you know, going forward it is you know, an amazing strategy which hopefully will have a very, very positive impact on that retention and recruitment.
Thank you, Katie. Welcome that. Ian, I'm not sure whether Carol has answered your question, but would you like to ask any further question of Carol in relation to that?
No, I think Carol's covered exactly the point that I was asking. Thank you very much.
That's great. Trish, do you have a comment?
Yeah, I very much welcome this, and it's something that I think will help in our recruitment, retention, providing opportunities for our clinicians here. But I'm particularly pleased to see the work stream around carers and volunteers. It's so important that we do look after our carers, and it's been something that I'm really pleased that we're now taking forward in a structured and formal way. Thank you. Really excited.
Yeah, thank you, Trish. And I agree. I would echo all those points. I've been saving this for last because I would like to say how delighted I am to see that you will have a school of research, because we will be able to attract researchers, even if only on a part-time basis from outside Powys. I'm sure those who want to, for example, conduct research into particular aspects of rural healthcare. So I think it's a wonderful opportunity for us all and for the Health Board as a whole. So delighted. I'm not really expecting anyone to dissent. So can I ask you to approve the blueprint? And remember, it's very early days for the Academy, and approve the work to meet the ICF funding allocation to redesign the initial physical space within Basil Webb. Wonderful, but within a pretty limited time frame, up to the 31st of March 2022. Is everyone happy to approve? I can see lots of people saying they are, so I'm grateful to you for that. Thank you. Wonderful.
Excuse me, Chair, I'm sorry to interrupt. It's Susan Newport here. I'm having problems with the chat bar, but I just wanted to add that I think the clue's in the name, Powys Teaching Health Board, and this is a development that we really need. So again, yes, exciting, but very necessary. Thank you. Sorry to interrupt.
No, that's absolutely fine. Thank you. So good, excellent, which means perhaps we can move on to agenda item 2.4. Regional Partnership Board, yes, Winter Unscheduled Care Plan. And I think that's you, Jamie.
It is.
Chair, I think we've just picked up a message that we might have lost Jamie's connection. So, Jamie, are you there?
I'm here, Carol.
Oh, great. Lovely.
No,
sorry.
I was just, yeah, no, I'm here, colleagues. Thanks. I don't know how I follow that positivity around the last item. It's a very exciting development. What best to talk about other than winter? As a segue from that into it, clearly colleagues will recognise that winter is here. It's a very different kind of winter already, and it comes on the backdrop of incredible effort across health and social care and all agencies across NHS Wales and wider due to the COVID pandemic. So I think that's an important context as we go into the winter period. Members remember that, colleagues remember that at last month we approved the Winter Protection Plan, as it's called, which was submitted to the Welsh Government. At the time of that paper, I think we flagged up that contents of our traditional winter unscheduled care plan were already in that Winter Protection Plan, but there was a requirement from Welsh Government that the Regional Partnership Board, of which we're a proud member, of course, developed a winter plan specifically for that and submitted by the end of October. That was completed and submitted by the partnership. Colleagues remember from last year, it was very similar to a paper that we would have done as a board ourselves last year with our partners. But this year was the first time that the paper has been submitted and the plan has been submitted under the formal RPB banner, recognising that the RPB is not a statutory body in itself. So the paper therefore is brought forward to this board for ratification of that submission. I won't go through the paper. The plan is 24 pages of it in it, and it articulates the range of services and how we will interact together as a partnership to support our teams, our services, and of course our patients and citizens. The earlier part of it does flag up, however, that Welsh Government allocated additional funding of £417,000 to the RPB. That money actually comes into the health board, but is to be transmitted through to the RPB partners accordingly. The paper summarises the allocation of 417 across a range of services. Those services that were identified for additional funding was based on a process of the learning from last winter. There was clear direction we would focus on the discharge, recover and assess, D2RA as it's called, pathways. But we learned a lot last year. We have a good baseline of D2RA already in place in Powys, and this was taking through understanding the the funding streams that came. Sorry, I apologize for the distraction there. Sorry, that the this work through the funding that came through and identified the learning from last year, but also particularly the learning through the demand that we're facing due to COVID. So it was important that we looked at what things worked well last winter, but also what things perhaps we missed out on in the end and we thought would have helped us better going forward. And that's where that money was directed to supplement the existing services in the partnership. So the actual plan isn't just focused on that 417k of funding, it's on everything else, but articulates at the front what the additional funding is for. So beyond that, as colleagues will recognise, we are preparing and actively working through these plans, the services in place. I think we recognise it will be a different winter, a challenging winter, but the teams are focused on that already, working across local authority with Powys partners, agencies like Welsh Ambulance Service Trust, Welsh Government colleagues, and of course, particularly our contractor partners in primary care within Powys, who are key players for us across the rural communities of Powys. So I'll stop at that point, and I'm happy to take questions from colleagues in support of this document and this plan for the winter.
I think really we're really just being asked to ratify this, but if there are any sort of questions, and if there's any information anybody needs, would they please ask now? If not, can we just go ahead and ratify, please? Thank you.
Thank you, Chair.
Thanks very much, Jamie. Right, now the business case for the Radiotherapy Satellite Centre at Neville Hall Hospital. This is for Hayley to take, and Hayley, if you'd like to speak a few words of Welsh, that would be very welcome.
Okay, diolch Cadeirydd. Dwi'n falch iawn I gyflwyno achos busnes I datblygu canolfan loeren radiotherapy yn ysbyty Neville Hall. Thank you, Chair, for the opportunity to present the outline business case for a radiotherapy satellite unit at Neville Hall Hospital. The attached case sets out a really strong case for change and the benefits that the new centre will deliver for the region. We are aware that demand is increasing and cancer incidence is also increasing, and radiotherapy demand has reached an all-time high. Radiotherapy activity is projected to continue to increase at 2% per year, and the modelling that underpins this case demonstrates that there is a need for 10 LINACs by 2023. And the case at Neville Hall sets out that it will be providing 2 LINACs, and there are further plans to provide further LINACs at the new Velindre Cancer Centre. It is clear that access rates for radiotherapy has been relatively poor compared to the evidence, and we are trying to address through this case improved patient experience through bringing care closer to home, as people have been travelling significant distances for radiotherapy across the region. And the development of this centre will absorb about 20% of the Velindre Cancer Centre current demand, which is a really important element. This is set in the context of the Transforming Cancer Services programme, which proposed this network model, and this is tried and tested and a model that's supported by the Royal College of Radiologists, but also is a network model that's used by leading cancer centres in the world, and they deliver good outcomes. So the centre will have facilities to deliver pre-treatment education and radiotherapy planning, and also the treatment. This will give us capacity to treat up to 80 patients per day. The case, this case offers really an early implementation of increasing radiotherapy capacity in South East Wales and for the South Powys patients. And in the cover paper, we set out the potential for further repatriation of some Powys patients who are currently accessing treatment in Cheltenham and Gloucester, and that is a potential as a result of this investment. So the benefits are many. improved access to radiotherapy, local outreach services that promotes more equitable access. There's also improved integration of services, and there would be increased oncology presence in secondary care, which would help to better integrate and coordinate treatment and care, and also that opportunity to transfer knowledge and skills. The increased flexibility to increase capacity is key, and we're also expecting through this development to increase the percentage of patients accessing clinical trials. And last but not least, that improved patient experience and reduced travel times is a very clear benefit. This case is funded from capital perspective from Welsh Government, and sets out a capital cost of just over 25 million. So as a commissioner, we're asked to consider the revenue consequences of the scheme, and there's a tried and tested approach around how we split commissioning costs across the various health boards, and our proportion of that is 2.14%, which would equate to just £54,500 per annum additional recurrent revenue costs. So I'd like to recommend to the board today the approval of this case. This really is an important development, and obviously it ties very closely with our strategy within Powys about bringing care closer to home, but also cancer has been identified as one of the big 4 priorities. And this case offers the quickest possible programme to provide additional radiotherapy capacity in South East Wales. Pending our approval, the Health Board's approvals, and also the Welsh Government approval timetable, the centre is aiming to be up and running by August 2023. So I'm more than happy to take any questions people may have.
Thank you, Hayley. Excellent news for our patients. Any questions, please? Katie, would you like to make an observation?
Yes, thank you, Chair. I just thought it might be useful following on from that, just to say how supportive the CHC is of this particular proposal. It's been discussed at Executive and Services Planning Committee. Haven't obviously had the opportunity to make a final decision on it, but it is a really, really positive move, as Hayley's mentioned, from the point of view of accessibility and travel times. And in fact, this week I met Andrea Haig, who's the Director of Cancer Services at Flindra, just to talk about the engagement going forward. And Hayley and I have already started the communication engagement going forward on the full business case. And Hayley and I have already had initial discussions about that. So really, really positive, and delighted that it's coming. The proposal is that it comes to Neville Hall.
Thank you, Katie. Are there any more questions? Could we then proceed to support this outline business case and approve it, ratify? Everybody agree? Thank you very much. That's great. Right. The next item is item 2.6, the Charitable Funds Annual Report and Annual Accounts for 2019 to 20. These accounts have already been considered by the Charitable Funds Committee, and they've been looked at Audit, Risk and Assurance. So if you go ahead.
Thank you, Chair, and thank you for giving that introduction. You've taken some of the words I was going to use. So yes, I'm pleased to present the Charitable Funds Annual Report and Annual Accounts for the period to 31st of March 2020. The report and accounts are recommended for approval by the board by the Charitable Funds Committee, and as mentioned, they've been through Audit Committee. The board are to approve as the corporate trustee. Based on the fact that we did not exceed the threshold for charitable funds, the report and accounts have been subject to independent review by our external auditors, being Grant Thornton. They had no issues to raise, and their report is included in the papers. So the board are asked to approve submission to the Charity Commission. I won't go through the detail of the accounts, but happy to take any questions.
Thank you, Pete. Any questions? As trustees, we have huge responsibilities, so it's very, very good to see that these have already been through scrutiny by 2 other committees. Can we then ratify? approve and ratify. Oh, Trish, yes, please come in.
Just to say, I'm pleased to ratify that. I think we've made quite significant progress during this year, and I'm happy that we've now sorted out our reserve policy. So thank you.
Yeah.
Thank you.
Thank you very much. Do you all happy to ratify? Thank you very much. That's great.
Thank you. Thank you, Chair.
Thank you, Pete. We'll be hearing from you again, no doubt. Not about this. Could we then now all agree, I'm sure there won't be any dissenters in this, to a comfort break. We're doing very well on time, so could we make it 10 minutes, please? And I will give you a message in the chat bar to say that we're ready to continue. Thank you very much. Croeso, welcome back to the second part of our meeting. We will continue now with agenda, the section of the agenda, which is the third section, agenda item 3.1, which contains a number of matters for discussion. So I'd like to ask Hayley again, please, to come in to talk about integrated performance overview, month 7.
Diolch Cadeirydd. Dwi'n falch eto i gyflwyno yr adroddiad perfformiad diweddaraf. Thank you, Chair. I'm pleased to present the latest board performance summary report. You'll see in the first part of the report, we provide the latest COVID-related performance, and the position as of yesterday, we now have 1,342 residents who have had a positive test outcome. The 7-day incidence rate for this week has further reduced, but you know, we continue to recognise that there has been a positive impact as a result of the fire break. Sure, we continue to encourage everyone to take steps to reduce the risk of the spread of the virus further. We continue to deliver testing, and there's detail in the report around that, and also that we've had robust performance in relation to following up contact tracing within the 24 and 48-hour timescales. Sadly, as at the 20th of November, 131 Powys residents have sadly lost their lives to COVID. And in relation to incidents and outbreaks, we're working very hard to make sure that incident management arrangements are fully in place to manage those incidents, with a strong emphasis on ensuring that learning is being applied to other similar settings. Carol already mentioned earlier around the significant work that's being undertaken to prepare now for the mass vaccination programme. So we will be expecting to report on the progress of mass vaccination much more strongly in future performance reports. Whilst responding to the pandemic, we're continuing to pursue other important priorities, but it is important to note that during this second wave, we're seeking to maintain essential and as much routine care as possible. And obviously, we've just had the update from Jamie around the usual pressures that we're dealing with as a system around winter, around both attendances and admissions. So the health and care system is currently under significant strain, and some providers for the Powys population have had to temporarily suspend non-urgent services during this time. So we continue to work very hard on our recovery planning in terms of the early stages now of understanding how we can deal particularly with a growing backlog of patients that are waiting for treatment. The scale is substantial, and it will take us a significant amount of time to recover fully the position. The report highlights the latest position for Powys as a provider, and although we have made good progress in putting back in place a number of services, there has been reduced capacity as a result of the requirements that need to be put in place. And you'll see from the content of the report that now we have got a significant number of people waiting over 36 weeks for treatment as a Powys provider, and also waiting over 52 weeks. That figure is increasing, and unfortunately, as a commissioner, we also have a situation where we've got a significant number of patients waiting over 36 weeks, over 3,000, and now nearly 1,500 patients waiting over 52 weeks. So a key challenge for us will be to focus on developing the recovery plan in the context of our annual plan to deal with this backlog, and this will take very different ways of working. And although we'll need to focus on local action, there's a lot of work currently being scoped out at both the regional and national level to make sure that as a system we can address the scale of this challenge. So despite this being a difficult and challenging period, the report also highlights continued quite robust performance across a number of other key areas. And I just wanted to highlight a couple really as an introduction. I think particularly we've been as a board concerned around the impact on the mental health and emotional well-being of our population, around particularly the impact of the pandemic. And although we've seen increasing referrals and demands for those services, there continues to be robust performance in place around the mental health measures. And obviously, in terms of the workforce measures, the workforce is our most important asset during this period. So again, that continued focus on making sure that we're taking time to spend with staff through appraisal meetings, but also ensuring statutory mandatory training is in place and support mechanisms, as well as our position as a rolling figure for sickness at the moment at 5.01%, you know, is kind of doing quite well compared to other areas. So generally a challenging report in that the impact of the pandemic is significant. We're continuing to pursue a number of priorities and really happy to field any questions you may have regarding the report or any points of clarification.
Thank you, Hayley. Are there any questions, please? No? Well, thank you very much. Some very sad information there, as well as some good positive things that we
I think the chair might have frozen, not personally, but her IT connection. I wonder, just as that gets resumed, if I might just add a couple of comments, if colleagues can hear me. We will be having the Experience, Quality and Safety Committee meeting. That's coming up next week, and I know that the reaffirmed commitment to ensuring those meetings are maintained throughout the winter has been discussed earlier. I think Hayley, in flagging the really significant concern that we have around the numbers of patients who are waiting for treatment, that issue in and of itself is, I think, of particular importance to the Experience, Quality and Safety Committee in terms of our approach to supporting people, and the mechanisms we've already put in place and how effective they are around assessing the urgency or otherwise of access to treatment. And in terms of how we are supporting people who are waiting for treatment. There is an essential services assurance framework, and we're currently working with that. That was issued by Welsh Government as part of quarter 3 and 4, and we'll be able to give more detail to the Experience, Quality and Safety Committee on what steps we've been taking to ensure wherever possible people are supported whilst waiting for definitive treatment. So hopefully that's helpful, Mel, both as in your role as Vice Chair, but also as Chair of Experience, Quality and Safety Committee. I think we may well have lost the connection of the Chair, so I assume, Mel, that you're going to step in.
Thank you, Carol. And can I say, if we move on, which obviously we will do, and I'll pick up on behalf of the Chair after this item, considering this will be coming through into EQ&S, I was going to say, particularly around our waiting times, if we could have the information, if possible, on where we might be seeing the different ways of working that can be put in place to reduce the harm and the impact that the times are going to be, obviously. I think that would be a very useful discussion if we could focus on maybe that as well for the committee, so that we can have an all-round view of when we can, how we can start tackling it going forward, you know. Okay. I don't think Viv is with us. Have we got any other comments on this particular agenda item? Katie, if you could come in, please.
Thanks, Mel. I was going to raise it in my report, but it might be opportune to do it now. Yesterday, we published a national report on feeling forgotten, which is about the non-urgent and the routine services. And I was just thinking, as Carol was speaking, it might be useful for the Equality and the Experience Quality and Safety Committee, perhaps to have sight of that to inform that discussion going forward.
That's a very useful comment. Thank you, Katie. And I expect we could have that delivered to actually maybe all board members, just to make sure we're cited on it. Would be a useful document. Thank you. Any others on this particular agenda item, please?
Yes, it's Trish back in here. Sorry. We are in very challenging times, and we will be picking this up at Quality and Safety, but I was disappointed.
Trish? No, I think Trish might have dropped out as well.
No, I'm back now. Basically, I was disappointed in the child and adolescent mental health performance, but I'm pleased to note that we're on track to recover that.
Thank you. Yeah, and we can also have a bit more detail if you wish going forward around that in EQ&S.
That'd be helpful. Okay, thank you.
Okay, thank you very much. Any other comments? No? Okay.
Now,
so, yes.
Now, I'm sorry, I was trying to type into the side, but I take a comment on that. Trish, happy to discuss that offline, but we can confirm we've achieved the targets in the most recent period. So I think I can tell you a positive story offline on that with the latest data. So pleasing to see going forward. Yeah, mental health measures have been achieved for the first time systemically across Powys in the current month. So there you go.
That's such good news. Thank you.
That's excellent news, and it is right across the board, is it? Or
yeah, across the.
Yeah, that's very good indeed. Thank you. Very positive. So well worth asking the question because that's a great update. Okay. If there aren't any others, no. Can we go on to please 3.2, which is the financial performance report for month 7, please. Which Pete, if you can.
Thank you, Mel. Thank you. So I'll take you through the finance report as included in the papers. I'll just take us through the key issues and we can pick up any questions as we get to the end, and I'll reference the page I'm referring to as I go through it. So first of all, as at page 2, our revenue position as at month 7 is an overspend year to date of 259,000. That did have an improvement in month of 43,000, and we continue to forecast a break-even position. That's based on the assumption that we will live within the funding as allocated in response to our Q3 winter response plan and COVID. Our capital position is that we've spent just under 1.5 million year to date against our current capital resource limit of 2.2 million. That resource limit will increase as we incur further expenditure in relation to COVID and is as per plan submitted to Welsh Government. And currently our public sector payment policy target, we're at 92.5%, so just under the 95% target. If I can take you on to page 8 of the report, in here this details the current forecast spend in relation to COVID. The total forecast is just over 26 million. That is as per our Q3/4 plan as referenced earlier, based on the assumptions around surge capacity and based on the funding as allocated. So our plan is to live within the funding as allocated. If I reference page 9, this gives a high level overview of how our current forecast is made up. This tracks us from our original IMTP position, picks up in-year budgetary pressures, risks, opportunities, our spend in relation to COVID and current funding assumptions as confirmed to take us to our break-even position. And if I can take you to page 10, this highlights our current risks and opportunities against the plan. These are risks and opportunities not included in our forecast. First to note, you will note that the risk number has reduced dramatically. On our previous board, that was circa 20 million because it included the funding assumption in relation to COVID, which has now been confirmed. And the main risk area is if the demand for surge capacity exceeds the level within our planning assumptions. On the flip side, in our opportunities, if the demand for surge capacity is lower than planned, there may be potential slippage. So it's a quick overview of our current financial position, just to say that there be a need for close monitoring and reporting of our performance against our plan. We'll need to highlight any variances as quickly as possible so remedial action can be taken to deliver our forecast of break even. Happy to pick up on any questions or queries that people may have. Thank you.
Thank you very much, Pete. Has anybody got any questions that they'd like to raise at this point on the financial report? Any comments? I mean, I would just say thank you for the work involved. Obviously, you can see the two streams and the COVID, you know, and how that aligns to our own budget. But that's not to take away the amount of work that must have been put in just to keep our own budgets on track. And so to be able to come to board and say that we are still in a potentially a break-even position, I think is really commendable. So, Carol, if you'd like to come in.
Yes, thanks very much, Chair. Just a quick comment, really, not necessarily on this year. I think Pete's been able to describe that really well, and hopefully people can understand that. But it's really the forward look to next year. We don't yet know what the financial outlook will be for the coming year. We have described today the real challenge that we have around the numbers of people who have had their care and treatment delayed, and the need for us to catch up on that as we hopefully come out of the pandemic. We at this stage have not yet completed the assessment work that would then lead to a proposal for that catch-up programme. So that is currently not budgeted as we think forward into next year, and we will be doing that work now over the next few weeks and months. Equally, I understand that there has been an allocation or an announcement of an allocation for next year for the NHS in England. We do get a consequential that comes into Wales as a result of that. What we don't yet know is whether that will come through to the health service or not. So I'm flagging that as a risk on the horizon, really, for board members to be aware of, and we'll be working really diligently now over the coming weeks and months to try to quantify what that recovery looks like and the investments that may well be needed to support it.
So could I ask on the back of that sort of statement, which is really going to be important for us, isn't it, going forward? I'm asking you to scry really, which is unfair. You can't look into the future, but when we would normally expect to have, I suppose, the assessment work first to start understanding our positions going forward. And then a sort of take from Welsh Government, which I presume would have to come from Central, on those budgets going forward. Are we looking at April or March or February? You know.
No, not a problem. Perhaps if I say a few things, Pete might well want to come in. But the fact that we've just approved earlier on in the meeting the planning ahead strategic objective, we've actually already kicked off that work. You know, earlier this week we had a discussion as execs and senior managers in our delivery and performance meeting. We've got a board development session, I think, on the 8th of December that will be an important opportunity for all board members to engage in those discussions. I think we're having the finance allocation letter on the 24th of December or thereabouts. But the dialogue with Welsh Government will be starting now in earnest on the planning ahead element. We do have an assurance meeting coming up with Welsh Government colleagues, and I think that they'll want to get a real sense by January, Chair, of our potential approach to this. But Pete may well have more detail on that at this stage.
Thanks, Carol. I think you covered that really well. Yes, the pre-Christmas treat is our allocation letter due on Christmas Eve that gives an indication of the funding to be received by Welsh Government to inform our plans. I think, as Carol alluded to, it's a bit of a continuous cycle of always developing your plans, identifying what needs to be done, how our financial strategy meets our operational plans and strategy. So we're constantly working on that, and I will say there is good dialogue between Welsh Government, the Finance Delivery Unit and Health Board. So we get early indication of sort of expectations, and so we're all in a common place around that. And I think as and when we get updates, we can bring that back to board and various committees for decision and discussion.
Okay, thank you for the assurances around that and in the updates anyway. And obviously we'll be looking forward to the 8th of December for the board development to see if we can get a handle on that. That's great. Nobody else has indicated, so we can move on, please, to the Breathe Well Respiratory Transformation Programme update, which is great to see at board level, and that's going to be the Director of Therapies and Health Science, please, Claire.
Thank you, Mel.